Knock, knock.
Come in.
Hello, sir. My name is Melanie, and I'm a student NP from UNLV, and I'm going to be performing a comprehensive exam on you today. Okay, so what is your name, sir?
Brandon.
Brandon. Let me start by washing my hands, Brandon. I'm gonna place this on you. Okay, Brandon, what brings you to the clinic today?
My yearly checkup?
Okay, do you have any chronic illness such as diabetes, COPD, or hypertension?
No.
Are your immunizations up to date?
Yes.
When was the last physical?
Last year.
Okay. Do you smoke, drink alcohol, or use illicit drugs?
No.
Does your family have any chronic illness such as diabetes, COPD, or hypertension?
No.
Do you take any prescription or over-the-counter medications?
No.
Do you have any allergies to food, medications, or environmental?
No.
Alrighty. So I have a male patient, approximately in his 20s. He's awake, alert, and responsive. He's sitting upright. He's well developed and nourished without any obvious deformities. He is calm, mood and affect are appropriate. His speech is clear and articulate and no acute distress. All right, so now we're going to begin the physical exam. If you have any questions or any pain, let me know, okay? So I'm going to have you smile, frown, puff out your cheeks. Okay, facial expressions are symmetrical. Cranial nerve 7, facial is intact. Any of this hurt?
No.
Hair is soft, light brown, evenly distributed on the head without inhabitants. Scalp is white. No lesions noted. Head is normocephalic without masses or tenderness. Temporal pulses are 2+ equal bilaterally. Does that hurt?
No.
Frontal and maxillary sinuses are non-tender upon palpation. Go ahead and open your jaw for me. Move it forward and backwards, side to side. Any of that hurt?
No.
No TMJ tenderness noted. No clicking or popping with full range of motion. Cranial nerve 5, trigeminal is intact. Alrighty. So I'm gonna note that the eyebrows are symmetrical, and the eyelids are without redness, swelling, discharge, or crusting bilaterally. There's no eyelid drooping or ptosis noted. Cranial nerve 3, oculomotor is intact. Does this hurt?
No.
Okay, no drainage or tenderness of the lacrimal apparatus bilaterally. Go ahead and pull down your eyes for me like this. Okay, the conjunctiva is clear, pink, and moist bilaterally, and the sclera is white and moist bilaterally. Okay, ready, you're good. Okay, so now we're going to begin some eye exams. You're going to hold this about 14 inches away from your face. Go ahead and cover one eye and read the lowest row of numbers that you can see.
4, 2, 6, 7, 3, 9.
All right, and the other eye?
4, 2, 6, 7, 3, 9.
And then go ahead and both eyes.
4, 2, 6, 7, 3, 9.
All right, keep the note card. All right, so now we're gonna test your peripheral vision. We're gonna cover the same side eye, and I want you to say now every time you see my hands enter your visual fields, okay?
Mm-hmm. No. 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 No.
Okay, and then cover the other eye.
No. 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 No.
Okay, alrighty. Visual acuity is 20 out of 20 without corrective lenses on left, right, and both eyes. Peripheral vision is equal to examiners. Cranial nerve 2, optic is intact. Go ahead and look straight ahead. Negative cover uncover test. Steady fixed gaze bilaterally. Extraocular muscles are intact. No nystagmus noted. Now I'm going to have you, without moving your head, only using your eyes, I want you to follow my finger, okay? All right, the extraocular muscles are intact. No nystagmus noted. All right, now I want you to look at my nose. Okay, corneal light reflex is equal bilaterally. Negative Hirschberg test. Okay, now I'm gonna have you look at the wall, and then look at my finger, and then follow my finger. Okay, alrighty, and then now I'm going to take a look at your pupils. Okay, pupils are about 3 millimeters bilaterally. Pupils are equal, round, and reactive to light with accommodation, direct and consensual, convergence and constriction. Cranial nerve 3, 4, and 6, oculomotor, trochlear, and abducens nerve is intact. Okay. Now we're going to take a look at your eyes here. Okay, Alexa, good night. Okay, so now I just want you to look straight ahead. Other side. Okay. Alexa, lights on. Okay. The red reflex is present bilaterally. The retina is red-brown. The vessels are present all quadrant without AV nicking or hemorrhaging. Optic disc is yellow-orange in color with sharp margins bilaterally, and the macula is not visualized. Okay, so now we're going to move on to the ears. External canals are pink. There's no redness, rashes, skin lesions, or any masses. Does that hurt?
No.
It's non-tender upon palpation. There's no discharge, swelling, lesions. Okay. Now to test your hearing, I'm going to occlude your tragus and have you repeat back a two-syllable word that I say, okay?
Orange.
Okay. Other side.
Yellow.
Okay. Cranial nerve 8 acoustic is intact. Patient is able to identify whispered words without difficulty bilaterally. All right, now we're going to take a look at your ears here. Okay, canal is pink. Tympanic membrane is pearly gray. It's intact. Cone of light is positioned at the 5 o'clock position. Go ahead and close your nose and swallow. And it is mobile. And the other ear. Okay, canal is pink. Tympanic membrane is pearly gray. It's intact. Cone of light is at the 7 o'clock position. Go ahead and close your nose and swallow for me. And the tympanic membrane is mobile bilaterally. Okay, all right, so now we're going to start with the nose. All right, the nose is midline and symmetrical. There's no redness, swelling, lesions, or discharge. Go ahead and look up for me. Nasal mucosa is pink and moist, no discharge or lesions bilaterally. And the septum is midline without perforation or deviation. Go ahead and close one nose and sniff. Close the other nair and sniff. Okay, nairs are patent bilaterally. Now I want you to close your eyes, close one nose, and go ahead and identify the smell.
Peanut butter.
Okay, and then keep your eyes closed, close the other nair, and identify
Cinnamon.
Okay, sense of smell is intact, able to identify peanut butter and cinnamon. Cranial nerve 1 olfactory is intact. Okay, so now we're going to move on. Okay, the lips are symmetrical, pink and moist. There's no lesions. Go ahead and open your mouth for me. Buccal mucosa is pink and moist, no lesions or masses. There's 32 teeth that are present, white, intact, no dental caries. The gums are pink, well secured to the teeth. There is no swelling or bleeding. Okay, go ahead and stick your tongue out for me. Okay, the tongue is pink. There's no lesions or masses. It's symmetric. It protrudes midline. Cranial nerve 12, hypoglossal is intact. Lift your tongue up. Okay. Floor of the mouth is pink and moist. There's no lesions or masses. Tongue down. Sorry. Hard and soft palate, pink and moist. There's no lesions or masses. Stick your tongue out and say ah.
Ah.
Okay, uvula rises midline on phonation. Oropharynx is pink and moist. There is no redness or exudate noted. Cranial nerve 9 and 10. Glossopharyngeal and vagus nerve is intact. Tonsils are pink and 2+ equal bilaterally. Okay, I'm gonna gag you. Gag reflex is intact. Cranial nerve 9 is intact. Go ahead and close your eyes. I'm going to have you identify this flavor for me.
Orange.
Okay, correctly identifies orange flavor. Cranial nerve 7 is intact, and there is no halitosis noted. All right, so now we're going to start with the neck. The neck is symmetrical and supple. There's no lesions or masses. Okay, I'm going to feel for your nodes. Preauricular, postauricular, occipital. tonsillar, submandibular, submental, anterior cervical, deep cervical, posterior cervical, supraclavicular, infraclavicular. Okay, all nodes are non-palpable. Trachea is midline. All right, I'm gonna feel for your thyroid. Displace it. Go ahead and swallow. Okay, go ahead and swallow. Okay. The thyroid is non-palpable bilaterally. There's no thyromegaly or nodules bilaterally. All right, so now we're going to do some range of motion exercises for the neck. Okay, I want you to move your head forward, backwards, ear to shoulder, look left, look right, and then shoulder shrug. Okay, so now I want you to try and push / resist against my hand. Okay, so move forward, backwards, ear to shoulder, shoulder shrug. Okay. All right, so we have full active range of motion of the neck, muscle strength left equals right, 5 out of 5 bilaterally, cranial nerve 11 spinal is intact. All right, so now I'm gonna have you swing your legs over. We're gonna look at the back. Alrighty, okay, so I'm gonna note that the skin is pink throughout, no redness, rashes, or lesions. It's warm and dry to the touch. Go ahead and breathe in for me. Chest expansion is symmetrical. All right, so every time you feel my palm, I want you to say 99, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, tactile firmness is equal bilaterally. Okay, lung fields, bilateral lung fields are resonant, including the lateral lobes. Does that hurt?
No.
No CVA tenderness noted. Okay, and I'm gonna listen to your lungs, okay? Okay, bilateral lung fields are clear upon auscultation. No, there's no crackles, wheezing, or rhonchi. All right, so now I'm gonna have you swing your legs and move on to the front. Okay, alrighty. We're gonna note for the front that the AP diameter is less than the transverse diameter. No barrel chest noted. The skin is pink throughout. No redness, rashes, or lesions. Warm and dry to the touch. Skin turgor recoils to the baseline almost instantly. Go ahead and breathe in for me. Chest expansion is symmetrical. So now again, I want you to say 99 every time you feel my hand, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, tactile firmness is equal bilaterally. Okay, bilateral lung fields are resonant throughout bilaterally. And I'm gonna listen. Alrighty, and bilateral lung sounds are clear upon auscultation, no rhonchi, crackles, or wheezing. Okay, so now I'm gonna listen to your heart. Okay. Aortic, second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral, fifth intercostal space, left midclavicular line. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, S1 and S2 audible, no S3, S4 heard. On all 5 precordial sites using the bell and diaphragm with the patient in the upright position. There's no murmur, rubs, or gallops audible. Okay, so now we're going to begin the breast/chest exam. Okay, I'm going to note that the chest wall is flat and symmetrical. Chest contour and consistency is firm and homogeneous bilaterally. There's no redness, swelling, masses, or lesions observed bilaterally. All right, so now we're going to palpate the chest area. Okay, we're going to use 2 fingers using concentric circles in a vertical pattern, okay? So now I'm going to palpate, okay, around the chest, especially check behind the nipples in the upper outer quadrant, and then the axilla on both sides, okay? So I want you to lift your arm up so I can check your axilla. Any tenderness?
No.
Okay, and then the other side.
No.
No tenderness. Okay. There's no lumps, masses, or tenderness of the breast, areola, upper outer quadrant, and axilla bilaterally upon palpation. There's no dimple discharge or lymphadenopathy noted. And I just want to let you know that breast cancer in men is uncommon, but it is possible. So follow up with your doctor if you notice any changes, if you see or notice any lumps or masses. Okay, and I want you to do the same exact breast/chest exam at least once a month on the same day every month, okay? Alrighty. Okay, so now we are going to go down to, I'm going to have you lay down. Okay, so I'm going to note that there is no pulsations, heaves, or lifts on the precordium. Carotid pulses are 2+ equal bilaterally. Apical pulse is located in the 5th intercostal space, left midclavicular line. And there is no palpable thrills noted on all sites of the precordium. Okay. Okay, so now I'm going to listen to your heart rate. Okay, the apical heart rate is 60 beats per minute, it's regular rate and rhythm. Okay, now I'm going to listen to your heart again. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, S1 and S2 heard, no S3, S4 audible on all 5 precordial sites using the bell and diaphragm with the patient in the supine position. No murmur, rubs, or gallops heard. And no bruits auscultated on the carotid arteries bilaterally. Okay, so now I'm going to move on to your abdomen here. Okay, I'm going to note that the abdomen is flat and symmetric. The skin is pink, no redness, rashes, masses, lesions, or scars. The umbilicus is midline without any herniation. I'm going to listen to your stomach here. Okay, vowel sounds are present and normoactive in all 4 quadrants. No bruits auscultated. Okay, so now I'm going to palpate your stomach, okay? So let me know if any of this hurts. Does it hurt?
No.
Okay, I'm going to have you bend your knees. That actually helps relax the stomach. Okay, I'm going to go deeper. Let me know if it hurts. Does it hurt?
No.
Okay, So now I'm going to feel for your liver here. Go ahead and inhale and exhale. Any of that hurt?
No.
And the other side. Okay. Inhale and exhale. Any of that hurt?
No.
Okay. So the abdomen is soft. There's no masses, tenderness. There's no hepatosplenomegaly upon light and deep palpation. Okay. And the aortic width is about 2 centimeters. Okay, so now we're going to move on to the lower extremities. Go ahead and flatten out your legs. Okay, alrighty, I'm gonna note that the lower extremities are symmetrical. The skin is pink throughout, no redness, rashes, or lesions. Hair distribution is evenly distributed bilaterally. It's warm and dry to the touch. Does that hurt?
No.
There's no redness, pain, swelling, or deformities of the musculature. And there's no tibial, there's no pretibial or pedal edema present. Okay, pulpiteal, posterior tibial, and dorsalis pedis pulses are 2+ equal bilaterally. Okay, so now we're going to be doing some range of motion exercises for the hips, okay? So using one leg at a time, we'll start with the right leg. We're going to lift it up for flexion, back down for extension, out for abduction, in for adduction. Bend the knee towards yourself with internal rotation, out, external rotation, okay? And then we're going to do the other side. So up, flexion, down, extension, out, abduction, in, adduction. Bend the knee towards yourself, internal rotation, out, external rotation, okay? Alrighty, so now I want you to try and push against my hand, okay? So go ahead and lift up, down, out, in, all right, out, up, down, sorry, down, out, and in. Okay, perfect. All right, so now I'm going to have you go ahead and dangle your legs back. Okay, so now I'm gonna have you extend your legs and then back down, and then push against my hands and then back down. Okay, and then with the ankles, we are going to put them up for dorsiflexion, down for plantar flexion, inversion, eversion, and then rotation. Okay, and then I want you to push against my hands, okay? Up, down. Okay, and then with your toes, we're going to curl them and then extend them out. All right, so now we have full active range of motion of the hips, knees, ankles, and the toes. Muscle strength is full 5 out of 5, equal bilaterally. And then, let me see, the bottom of your feet. Negative Babinski reflex is equal bilaterally. All right, so now we are going to move on to the upper extremities. Okay, so I'm gonna note that the upper extremities are symmetrical. There's no redness. Skin is pink throughout, no redness, rashes, or lesions. It's warm and dry to the touch. Does that hurt? Okay, no redness, pain, swelling, or deformities of the musculature. Let's see, nail bed is flat and pink. Going to go like this, approximately 160-degree angle. There is no clubbing, discoloration, or cyanosis. Okay. Brachial and radial pulses are 2+ equal bilaterally. All right, so now we're going to be doing some exercises for the upper extremities. Okay, and I can't remember, but upper extremities are symmetrical. Okay, alrighty, so now we are going to flex them, extend, hyperextend, add abduction, adduction, internal rotation, external rotation, and circumduction. Okay, so now we're gonna add some resistance. So I want you to lift your arms up, then back down, out, and then back in. Okay, and then with your elbows, we're going to flex and extend, and then add some resistance, flex, extend. And then with your wrists, we're going to flex, extend, supination, pronation, radial deviation, ulnar deviation, rotation. Okay, and then we're going to go ahead and push against my hands, up, down. Okay, your fingers, we're going to flex, extend, abduct, adduct, and then grasp my fingers. Okay, so we have full active range of motion of the shoulders, elbows, wrists, and the fingers. Muscle strength is a full 5 out of 5 equal bilaterally. And go ahead and grasp my fingers. Sorry, I can't remember. Finger grasp are equal bilaterally. All right, so now I'm going to have you close your eyes and open one palm. Go ahead and identify this item for me.
Coin.
Okay, other hand. Identify this for me.
Paperclip.
Okay, stereognosis is intact. Keep on closing your eyes here. I'm going to draw a number. I want you to identify it for me.
1.
Okay.
3.
Perfect. Okay, you can open your eyes now. Graphesthesia is intact. Okay, so now this is sharp and this is a dull sensation. I'm going to do it throughout your body. Go ahead and close your eyes and identify which is which for me, okay?
Sharp, dull, or sharp, 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 dull, 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 sharp, dull, dull, sharp, 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 sharp.
Okay, and then whenever you feel this, I want you to say now, okay?
Mm-hmm. Now, 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 now.
Okay, sensation is intact bilaterally with using superficial pain and light touch on all extremities, including the face. Cranial nerve 5 trigeminal is intact. Okay, so now we're going to do some rapid alternating movements. So we're going to slap our thighs, and then we're going to rotate them up and slap them again, and then go ahead and go faster. Okay, perfect. You can stop now. Rapid alternating movements are intact, smooth, accurate, and coordinated. Okay, so now we're going to be doing, I'm going to check your reflexes, okay? So go ahead and just relax. Okay, the biceps brachioradialis,
Do you want to fix the camera?
patellar, and Achilles reflex are 2+ equal bilaterally, and able to elicit the triceps reflex. Okay. Alrighty, so now I'm going to have you stand up and face opposite from me. Okay, let me just fix this. Okay, all right. Alrighty, any of that hurt?
No.
Go ahead and bend forward. Any of that hurt?
No.
Okay, alrighty, you can stand back up. Okay, the shoulder, spine, and scapula are symmetric. There's no deformity, skin changes, or trauma. The vertical column is symmetric. There's no deformities, tenderness, or curvature. The movements are symmetric and smooth, and the spinous process are midline and non-tender upon palpation. Okay, now we're going to be doing some range of motion exercises for the spine. Okay, so now we're going to bend forward, backwards, left and right, and then twist left and right. Okay, full active range of motion of the spine. Okay, so now we are going to do some walking. Okay, so now I'm gonna have you walk normally towards me. Okay, and then on your toes. And then on your heels. And then heel to toe. Okay, there's no gait abnormalities. The gait is steady, smooth, and coordinated. Coordination is intact with heel to toe. Okay, and now I'm gonna have you, we're gonna stand up. Arms at your side, feet straight ahead, and then I'm gonna have you close your eyes and stand there for 20 seconds. Okay, negative Romberg exam. Go ahead and sit back down. Okay, and this marks the end of my exam. I'm gonna wash my hands. Okay, did you have any questions?
No.
No questions. Okay, so I'm gonna give this to you, and then I'm gonna go ahead and leave the room, okay?
For the patient evaluations, for an introduction, she showed genuine interest. She did identify herself and what she was going to be doing, and her title she identified. Non-verbal behaviors, her tone of voice, I felt very comfortable, maintained eye contact. During the physical exam, I felt that my privacy was maintained with the placement of the towel. She did tell me what to do with clear directions. Verbal communication, I understood her and understood the teachings of the chest exam once a month. Overall rating, I would rate her a 12 out of 12.
Alrighty, thank you. Goodbye now.